So, our last talk for today is by a psychiatrist herself. When to seek the psychiatric help. Insights from a psychiatrist, Dr. Aiswarya R. Nair. She is a practicing psychiatrist at Kollam itself at NS Hospital. So, she'll be talking to us on what to do when there is stress and when should you actually reach out for medical help. Thanks a lot, ma'am, for taking time for us.
Thank you, Raghi. I'm Dr. Aiswarya. I work in Travancore Medical College. So after three very insightful sessions, I think I will just rearrange my slides a little. And then, so what they've asked me is to talk about the pathology. When should you seek help? So two important things while you identify the pathology. One, understanding the physiology. Two, trying to understand the signs of the pathology. So because of time limitation, I think we will focus on that. So what is a good mental health? Good mental health is a state in which you're able to realize your own capabilities, you're able to cope with the normal stresses of life, and you're able to work productively for yourself and people around you and make contributions to your environment and your society at large. So you can, what you can see is the word stress. So stress is something that is there in the definition for mental health also. So it's like stress, I don't like stress. I try to avoid stress, but stress follows me. So is all stress bad? Is that what we think of stress? So physiologically speaking, stress is just your body's response to challenge. So there is a positive aspect to stress that is called eustress. So like a mother told me, this is the environment I want to maintain at home for my children, is what she told me. So this is the sort of stress that brings about optimal levels of stimulation that results from challenging but attainable and enjoyable or worthwhile task. So there it is seen to have beneficial effect by generating a sense of fulfillment or achievement and facilitating growth, development, mastery, and higher levels of performance. So it can be something as simple as giving a talk. So it's not something that we do every day for a clinician. So once you've decided to do it, so you would be upskilling yourself for it. A lot of things that the prior speakers spoke about, those are things, how do you upskill yourself? Upskilling is something that we need to do throughout our life. We are all learners, especially doctors. So these are the sort of challenges that helps you upskill, and after performing it, it can be performing a dance for your conference today. So after performing it, it gives you something called mastery and pleasure. So any task that you want to perform and you've performed to your level of expectation is able to give you the energy or pleasure. And this is the energy that actually lets you move on to the next task. So that's called pleasure, mastery and pleasure. And it can increase your level of performance. So individuals maintain a fine balance between coping strategies and stressors. So when you're looking at a situation, an individual, there are three things that you have to consider. One is the individual and his coping strategies or his cognitive abilities. Next is the supportive environment. Next is the nature of stressor. Like we are saying, 55 hours is stressful. I mean, I really believe it. I would get very stressed. But then you have 79-year-old Narayana Murthy talking about more work hours. So it depends on a person's capability and, as Rakhi mentioned, priority. So for a person at that point, what is his priority? How much, what is his preference or priority? And based on that, and how much are you able to pull through? That includes your intellectual capacity, your cognitive strategies, and of course your environment. You have Sudha Murthy there saying, I don't expect him to take me for movies. So it depends on your environment and of course the nature of stressor. So when does an individual go into distress? A distress occurs when the individual is unable to manage the stressor or you feel overwhelmed. It can happen, see the equation we were talking about, the individual, the environment and the nature of stressor. So based on the individual, it can be something that far exceeds your capacity. or it can be something that you are asked to deal at a point when your resources are down. For instance, there has been a transition. You've had to deal with bereavement. You've had a failure that you didn't anticipate. Then your personal resources definitely come down. Right, so that can also be a point when you need to seek help. Next is your environment. Of course, even that has to do with your, like what Raki was saying. Raki is going through a transition. And like when you go abroad and all, so one of my mentors were telling me the only thing they ask you in the first 6 months of the fellowship is, how are you? Have the children settled down? So transition is something that is given a lot of importance while you are transiting from one phase of your life, even a place. So that is what you mean by your environment. You don't have your support system sometimes with you. The next is the nature of stressor, the sheer enormity of the stressor, the sheer novelty, like losing a parent for the first time, or for a young person losing a for a person who started the career losing a patient for the first time. All these can be a reason when your stress changes into a distress. So distress occurs when the individual is unable to manage the stressor or is frankly overwhelmed. So now the other concept I would like to talk about is, this prior speakers have given you a very good idea, very insightful talks on this. So that is burnout. How much time do we have? More? 10. Okay. So burnout, there are three aspects of burnout that I would like to explain. One was told to you by the previous speaker. The person has an energy depletion or emotional exhaustion. The second point, therefore, I would focus on the second point. That is, there is an increased mental distance. What do you mean by an increased mental distance? You don't feel like you are in charge of your work. You don't feel like, see, this is a typical, so if you ask a child, how's your exam? And he says, paper bhayangara tough airunnu. So what is the child saying? I am helpless about it. Right. If you ask a person who's alcoholic, enda kudikinne, friends karno, what does it mean? That means your locus of control over the situation, you're giving it outside. So how would it be if it happens in your workplace? So that is something what happens due to burnout. So that is something that in reality can make a person feel very helpless. So as long as you feel empowered to deal with it, you're not burnt out. And once you start feeling helpless about it, you just stop trying. So that is what an increased mental distance does to you during a burnout or when you're having a burnout. And that, of course, leads to reduced professional efficiency. Now, on the spectrum lies mental illnesses. So some of the common things, based on the templates that we've spoken about, one is an adjustment disorder. Right? An adjustment disorder is frankly when what we talked about, the stressor, the organism and the environment, there is an imbalance and you need help. So that is a time when you should ask for help, and the help would be divided into two phases. One would be your pharmacological drugs that can help you. Second, during this time, what we are trying to actually do is upskill the person. So all the things that they were talking about, your time management, how do you manage your emotions, how do you communicate better? Communication would be with yourself and people around you. How do you cognitively reframe the situations? So all that would be the targets for non-pharmacological interventions or therapy. So you would be taught to, or what we would be asked to do is focus on what is modifiable in the equation and work on it. So that is the role of an adjustment disorder. Now, something that we have to keep in mind is a biological depression. So as you all might be knowing, biological depression, bipolar illnesses, all these are very much linked to our body rhythms, circadian rhythm, your interpersonal rhythms, your social rhythms. So sometimes what we see is a stress that precipitates an underlying illness, or which causes a recurrence of an underlying illness. So these are the things that we would have to keep in mind. So a rule of the thumb for that would be dysfunction. Are you not able to? So, in terms of burnout, what are you saying? You're not doing as well as you should be. You're not at your optimal best. But here there can be frank dysfunction. So, what we see many times when you have clinicians coming is a lot of them are able to cope with it using their cognitive abilities. But there is a point when there can be a breakdown. Another thing is untreated depression can also have a lot of cognitive sequelae. So you've had an episode of depression which has not been treated. It can. So now dementia and depression are known to as precursors for each other. So that is the importance of getting a mental illness treated. So now the prevalence is, there is an increasing prevalence in healthcare professionals. So I think Sir had also spoken about it. So because of lack of time, we will just move on to the next slide. The relevance is definitely a reduction in your professionalism, quality of life, quality of care, and efficiency. So one of the most important aspects about stress management is identifying that you're stressed. So what we often see is a wife coming and complaining. Wife or someone, complaining, or a junior coming and complaining that he's losing it. Mornings are very difficult because that person just gets angry at me. But what lies beyond the anger might be an anxious surgeon, an anxious husband, or an anxious mother. Okay, so how do you identify your stressors? So what are some of the physical signs of stress? So physically it can be excessive tiredness, talking faster than usual, hyperactivity, change in appetite, change in sleep. Thoughts can be when you're in these loops of thoughts. You start thinking about it and at the end of your thought you're still there. So negative or pessimistic thinking, reduced concentration, inattention, when you're not being mindful. Behaviors depends on the person. It's like what I said before, you have an accident, a person comes out and shouts. One driver would come out and shout. That's what he does when he feels anxious. He gets defensive. Another person would crouch. That's what she does or he does when she gets anxious. You avoid. So the behavior would be an accentuation of the person's prior personality traits and also emotions. So, these are the sort of symptoms that I think we should look out for. And definitely one single word about management would be there is scope for pharmacological management and should be opted out. And definitely one thing that we all have to keep in mind is help seeking or seeking help is an adaptive quality. Human beings have never been known to be the most intelligent. We have known to be the most adaptive organisms. So help seeking is part of being adaptive. It's a sign of strength, wisdom, and professional maturity. And we don't have to wait till the breaking point. And the next thing is...
Let's conclude in 2 or 3 slides.
Yeah, so we'll conclude. So whom would you choose for seeking help? It can be at the level of it can be a personal help or a professional help. So I think since we're nearing the end, nearing the time limit, I think we'll wind up the presentation. We'll take questions if any.
Thank you, Aiswarya ma'am, for that wonderful talk on stress management. We ourselves take stress every day in our day-to-day practice unprofessionally, because we are not trained in doing all this, something which we have gained by our experience over the years we do, but it's all unprofessional. Thank you for putting it all in order and giving some scientific advice as to how we manage stress.
I thought the insight you gave were very practical and to the point, sir. Regarding the communication and the operation prior to, during an operation, how you would tackle it. So those are very important, and each person would excel in their coping strategy. നമ്മളാണ് നമ്മുടെ coping strategy യുടെ ഉസ്താദ്. So what you've been doing to deal with your stress goes a long way.
Any questions to Aiswarya ma'am? Or anything to contribute from your side, because all of us have been managing patients for a lot of years and we all had problems with the patients, we all had problems with our profession. our health, physical health, mental health, everything. So anything to contribute from your side? We have 1 more minute to go.
I just have a question. I know a lot of surgeons who actually take tab Angsit, Alprax just before surgery. And it has become a routine for them. Every day before surgery, they take it, and then only they'll do surgery. Sometimes some of them will take it in between also. So what do you think? Is this a good practice, or what should you actually do?
General advice, self-medication is a slippery slope. Specific advice, benzodiazepine is a drug that can cause tolerance. So continuous use means your 0.25 will not work. Then you will have to increase the dose. Third thing, again, like I said, you're a master of your choices. If this has helped you for a long time, I think before you stop, you should definitely speak to somebody about it. And it is, I also know a couple of people who are managing just fine with it.
Here again, I have something to contribute because she said self-medication of Angsit and all. Sometimes I take bronchodilators, and the day after I take bronchodilators, I have a little bit of tremor. So if I have severe cough at night and I am about to take bronchodilators, I just run through the next day's list. Do I have a macular surgery? If so, I'm not able to catch the ILM after taking a bronchodilator.
Can I make a quick comment? So you said the coping mechanism, what we do is the best. I don't think so. The perfect example is what she said, taking anxiolytic medications. Many of the time, our doctors, because we are scared to go out and tell our problems, that, okay, I'm feeling upset about this. I think it's very important that we must realize that we are human beings first. We should not self-treat ourselves. We should be bold enough to go to a specialist, acknowledge our feelings. I think the best thing is to be mindful of our emotions. Acknowledge them, understand that it's okay to sometimes feel jealous, upset, angry in certain situations. Acknowledge it, and if you're not able to control it with your own coping mechanisms, I wouldn't tell you to self-medicate yourself. Please go and talk to a specialist. Sometimes you just have to talk to a friend. Talking to a friend really helps. And if the friend is not a professional, it'll be even better. A non-professional friend can give you the perfect advice of what you can do. Because sometimes, you are scared to open up to a professional because you think, oh, there'll be judgment. So this is my coping mechanism.
I'm glad I got an opportunity to clarify. What I meant by your coping mechanism is, see, pranayama is something that works for her.
Yeah.
Going to a temple is something that works for another person. Going to a gym is something. So what you've done is you've put years of practice into it. And that has become good and useful for you. But all those symptoms and signs that I was saying should be your indicators that you are feeling overwhelmed.
Yes.
And it's time for you to seek personal or professional help.
I totally
And
agree.
self-medication is definitely a slippery slope. I don't know whether I miscommunicated. I wasn't advocating that.
Yeah,
Thanks for bringing it up.
I didn't
ma'am.
listen to your talk, but it's just
Yeah.
my perspective I wanted to share.
Thank you. I think
And
that was an
Dr.
amazing.
Samarapuri, regarding this, I'm working in a teaching institute. We plan for once in a 6 months for one-day trip. All our colleagues with family. That definitely helps a lot of problem. Stress relief.
That's amazing that there are people who are actually putting in thought, who are putting in time and organizing it. Absolutely wonderful, sir.
Thanks a lot, everyone, for being here. Thanks a lot.